was 5 years old when I joined the faculty. And this project kind of got started because of an existential dilemma that I was facing as a medical anthropologist. I have been teaching about epidemics for a long time. Anybody who's taken my classes, you know that I often assign the book Ebola Culture and Politics by the Hewletts, where they talk about their experiences as anthropologists in the Ebola epidemic, predominantly in Central Africa, 2008, 2005, 6, 7, in through that time period. And at the end of the book, they talk about recommendations for what anthropologists can do in a pandemic. Some of what they recommended was picked up in the West African Ebola epidemic. We had some anthropologists working with Doctors Without Borders. Not enough was picked up. A lot of their recommendations about institutionalizing anthropologists in World Health Organizations and other organizations were not picked up. But the book had a huge impact on me. And as I said, I make students in every one of my classes read it as an example of applied medical anthropology. So all of a sudden, I find myself on the other side of this. There's a pandemic happening all over. This is like April. And I'm wondering, what is my responsibility as an anthropologist? And I think about all the ways anthropologists have interacted with public health people in getting messages out and making those more appropriate. And it quickly became obvious that public health, even in April, it was obvious that public health was getting shut out of what was going on in the pandemic, at least in the United States. So I turned to a different approach, which was, okay, let's at least chronicle what's going on. Let's chronicle how this is impacting some of the most vulnerable people in our community. And let's also find out what issues they're dealing with right now and get them help with whatever of those issues we can. So that was kind of the genesis of how I came to this. Dillon and I talked. Dillon and I have been working with Congolese refugee populations for about 5 years. I've been working more broadly with refugees in Tampa for about 10 years. And we came to this and just started thinking about, where could we be going in this moment? What could we be doing that was meaningful? And this was an existential problem for me because nothing felt very meaningful back in April. I felt directionless, I felt lost. I saw the country spinning out of control, and I was trying to figure out, what could I do and what should I do? So that was the sort of mindset I brought into this. I'm going to turn it over to Dillon at this point.
Yeah, sure. My name is Dillon Mahoney. I'm an assistant professor here in the department. My background is really in East Africa. I've been working in Kenya since 2001. In large part, although I did work a lot with politics and with migration, and a lot of that has been handy in this project. I didn't start working with refugees until the fall of 2016, when Dr. Baer came to me and needed someone who spoke Swahili and had access to Swahili speakers. And at the time I was teaching Swahili just for fun, open to the public here with the Swahili Students Organization, which I advise. And we were able to start working really through 2017, initially on a project that Robbie was running, that was a nutritional and nutrition and diet project. That project then quickly grew into a project or a number of projects on bullying, school bullying, as well as gender and family dynamics, housing rights. And we had a YouTube video in 2018, or a YouTube channel, I should say, that we started in 2018. But the reality is that a year ago, if you had talked to me a year ago, I was trying to get away from working with refugees. It can be very all-encompassing of your time, especially in this environment where we're being called on all the time to do work like translation work. I'm being called on to do interpretation and translation work all the time. for the most part unpaid, but as part of a team of volunteers. And there are quite a lot of volunteers actually that are filling the gaps that are left by a lot of the budget cuts that we've seen over the last couple of years. But a year ago, my goal was to be in Kenya running a field school this past summer. And I had spent a lot of time negotiating an MOU and contracts and designing all of that. And then, of course, in about March, all of that came screeching to a halt. And there was this bit of a, an existential crisis there where it was like, what can we do? What should we do? And I know for the grad students here, you've probably experienced all of your projects and plans just sort of go up in the air. But that's, we had to be flexible. And that's really where it started. I'll give some credit actually to I was teaching my anthropology development grad course in the spring, and that was a good way to just sort of talk through some of these issues and make new plans, let's say, looking at you, Kristen. But what ended up happening, in fact, one of the early ideas here, so Krista Billingsley, who had been a postdoc in the department, she reached out to me very quickly and said, maybe we should be doing something. We had done some work on some housing rights videos before this. And then, of course, Robbie reached out to me and said, what are we going to do? I was working with a student of mine, a PhD student in public health, also MA in anthropology, named Renice Obure. We've worked together quite a bit. And Renice had started working for IRC up in the New York, New Jersey area, calling up Congolese refugees for them and just asking them if they were doing okay, asking them if they knew about the pandemic, they knew about the policies, they knew how to file for unemployment. And so one of the obvious questions we had was, is anybody doing that here? And actually nobody was doing that here in Tampa. And so it became obviously interesting for us. So we had those questions to work with. What kind of questions can we ask? Primarily, what do you need help with? Do you understand what's happening? There was also a Hillsborough County survey that went out in April, and Hillsborough County was trying to collect information from residents about their understandings of the pandemic and what they were doing in terms of precautions. But that was all online, link-based, English language, it was that kind of survey. And actually, and I'll just mention this, there were a lot of surveys that came out very early on that tended to be English or maybe English and Spanish. And we were, a lot of these were coming through the Refugee Task Force here. They were being sent to us, and people were looking for us to then just sort of forward this on to refugees. And our initial response was, people have so much trouble with email and internet access, and they don't speak English. It's what kind of data are they actually going to collect from that kind of system? And so we knew that with our long-term connections, and this is really actually key, that we had been working with the population of Congolese refugees here in Tampa for about 4 years. We knew that we had some key contacts that we could, get in touch with. We could use Zoom, we could use WhatsApp, and we could just start workshopping ideas. And this was really the first step was, again, call on, the gatekeepers, the people we had developed good rapport with, and, get their feedback. And so we had a number of early meetings with grad students who had experience working with us in the past. We had a couple of community volunteers. We had Angie Uimana and Eugenie Omur Tasate in particular. They're multilingual. They do a lot of translation and volunteer work as well with the community. And, it's impossible to count how many early meetings we had just to sort of plan the questions. What were we going to ask people? How are we going to reach out to them? What is appropriate reciprocity? Classic anthropology questions. But one of the issues we were running into is that usually in research, you do a lot of participant observation in person to develop rapport. And then, you can pull somebody aside and say, can I talk to you? Can I interview you? And we had to just basically leverage our older, relationships with the community to call people up and say, what can we do to help? Luckily, people knew us and were very responsive and were, I think, excited to hear from anyone checking in on them and excited to see that things were going well. And so the first step really was the development of a questionnaire that we used. And we're using this term questionnaire. This has been asked before why we use that term. It was a bit of a survey. It was the kind of thing we could have put into some sort of an online, link-based system. And we did use Qualtrics, if some of you may be familiar with Qualtrics, although we only used the Qualtrics link in the online Qualtrics system to enter our data instead of sending this to folks. So we set this up so that, we identified families. We thought we'd start with household heads, balanced by gender, from as many households as we could get. We estimate there's between 30, maybe as many as 40 households here in Tampa in the Congolese refugee community. Some of that is because there's a lot of out-migration that takes place. So many families that we had worked with have left, but there's always other families coming in. I think there were 3 families that came in early 2020, just before the pandemic. But that was the plan. And we were able to reach out and do this actually rather efficiently. For the technical specificities here, this meant largely printing off paper copies of our questionnaire. So we had roughly 100 questions, mostly very open-ended questions. And that was the real advantage to doing this as, remote, but in person, via the internet interviews, so that you could really get a conversation going with folks. And, for all of us who working on the questions as much as we did allowed us to get to know them very well. And so, you didn't even necessarily have to do one of these interviews question by question. You could kind of jump around. You could allow people to really express themselves. We also found that it was useful, but really possible to do these as groups. So we moved away from doing focus groups, but we would often have 2 interviewers. So one person who could actually talk and another who would record answers. I did a couple of these, for example, with Renice, where I would just sit there and be writing the entire time, right, while she would be having this conversation. Almost all of these were done in Swahili, although there were some done, with some mixed English. Some people felt more comfortable if they knew English, talking to us in English. There were also some, thanks to Angie and Eugenie, that were done in French, or a mixture of French, as well as some Kinyarwanda. It's a very complicated population that we often refer to as refugees of the Congo Wars, just because there's a lot of internal discussion about who is Congolese and who is not. But we were fairly broad and open with this. We weren't trying to draw lines. Central African refugees essentially is what we were focused on. And so that plan actually ended up working pretty well. And we were really scrambling to get this done. And then, what would happen is we came up with a system where, I would go and just sort of, if somebody would leave the paper copies of their interviews outside their door, I would pick them up. We had really no interpersonal contact, even on the team. We had one student, Michaela Inks, who would drop off soap. So we gave families soap, and both dish soap and dish soap that they could use actually as hand soap, and then also bar soap that they could wash with. That was one of the things that we found, is people complained that they couldn't afford soap, as well as masks. And Robbie is part of a big group that was making hundreds, if not thousands, of masks. And so we were able to distribute masks to families that didn't have them. And that was, in a sense, our form of reciprocity. I also threw in quite a number of bags of cassava flour, which is almost like currency with the Congolese. And yeah, do you want to?
Yeah, I just want to put in a comment here about the questionnaire. The questionnaire was broad. We can send people, if you're interested, a copy of our report. There will be ultimately a publication in Human Organization coming out in the fall. But the questionnaire started out being a basic med-anthro questionnaire, focusing on explanatory models. What do you call the new illness? What is the cause of it? What are the symptoms? What are the treatments? Very, very basic med-anthro started out. And then we moved into topics of work, family life disruption, precautions, things like that. But it was, for a number of the students who worked on it with us, an introduction to a really, in many ways, classic med-anthro study.
Right. And where we were able to go beyond what some of the other studies were doing, and talk to people specifically about employment issues, about issues of remote learning for their children, a number of different issues, in addition to just the specifics around what were they doing in terms of precautions, what did they know, how did they understand the disease. We even had a question in about how they saw the president and whether they thought the president was doing his job or not. So we were able to get some really neat data, including information on, for example, fake news and how they understood the news and what they believed, questions on vaccines. And we just kind of went for it. And most of these interviews, I should throw out, were about 45 minutes to an hour, although that depended. Some of them would go a bit longer, some would be a bit shorter, but that was about the length. So a couple of things that I want to throw out that made this possible. I think the long-term connections we had were initially really important for us. Zoom and WhatsApp were our primary methods of using this. So the technology I found was there. And even with the Congolese, which is a population of people who are not very good on email, very few have home computers and know how to use them well. What we did find was people are pretty good with smartphones, and they're pretty good with using WhatsApp and Zoom. They do talk to one another quite a lot. And so that was maybe a delightful surprise to me, that Zoom didn't seem to be an issue for anyone, that they were able to use that. And we could also do, for example, calls on WhatsApp that were video based, and those also worked quite well. But these issues of employment and unemployment were really key in terms of what ended up coming from our data. So, and I don't want to take too much time here, and I want to leave enough for Q&A here, but I'll run through quickly what we found. So we were able to finish up interviews with 21 household heads before we had set a date of June 20th as our cutoff. And so we could have actually interviewed a few more families, but we wanted to stop at that point just because actually we had some deadlines that we wanted to meet. And we had also sampled at that point. We knew the majority of families in the community, and we had a pretty good idea of what was going on. And we had been able to, for example, sample not only families who were doing pretty well. So we did have some families that were making, they didn't find themselves as living in poverty. There were a couple of folks, 3 or 4, who were working for the hospital, 3 as nurses, 1 as a driver for the hospital. We also had a number of families, though, that were making almost no money. Most of these families, I should say, are quite large. Our average size of a family was around 7 people. We had one family as big as 15, and that was with 13 kids in a 4-bedroom apartment. And most families that first usually arrive with between, it's not uncommon to have 8 or 9 kids, let's say, in a family. That has always created a problem for resettlement, because it means that it's hard to find an apartment or a house that can actually, accommodate that many people. And then that, of course, means that you have multiple people in bedrooms and houses that are just really, really full. And that ended up becoming an issue. The other thing we found, in addition to household size, which was something that we were interested in, was people are making very little money. We did ask people about income in 2019. The average we found was $23,000 a year, which is under the poverty line for families that size here in Tampa. But there were families that only were making, $3,000 to $6,000. Some families hadn't been here in 2019, but very few families were making more than $30,000. I think we only had 1 or 2. So all of these families, and that's, considering the size of these families, we're just barely getting by. And that's actually one of the big reasons why so many families end up leaving Tampa, because Tampa tends to be very expensive in terms of cost of living, and the jobs are very low paying. Other things, though, that were important that we found here, I think the primary thing that we found is that people knew about COVID. They knew what to call it. We didn't actually have a name when we did the interviews for the virus. We asked them first, what do you call this? And then we used that language throughout. But most of them called it something like Corona or COVID. They had heard of this. They also knew the precautions, and they were very scared, I would say. They knew what was happening. Now, one of the big reasons for this is that they were consuming a lot of East African television and French language television. And so they knew, for example, the words for social distancing in Swahili and in French, as well as in Kinyarwanda, because they had been consuming that media. And that media tended to just repeat what the WHO was saying. And so what we were finding is that, in fact, the Congolese knew in many ways more than what the average American knew about the virus, and didn't question a lot of what they were hearing from the non-English, non-American media. It was the American media that ended up being quite confusing to them. And maybe to all of you, you may be able to understand that. That becomes really important, though, because there was an assumption that we found from other researchers working on this issue, but also from folks at the Department of Health, folks at the resettlement agencies, that the problem with the Congolese would be that they didn't understand the virus, that they didn't know what precautions to take. And in fact, it was important that we realized that was not the issue. And in fact, people took it as rather offensive if you approached them with more information about the virus, when their issues were, we don't have masks. But even more importantly, there were a lot of families who told us they simply can't afford soap. And this isn't uncommon. We also had families, this has been true for the last couple of years, that you'll find a family that hasn't had electricity for a couple months. Their internet has been disconnected, and also just families who don't have soap. Not having soap has been an issue just, for years now. And so how does a family, right, wash more? You can ask a family, are you washing your hands? And, they kind of throw up their hands and say, I would if we had money to buy soap. So those are the kind of things that we were able to deal with quickly. What's interesting then is, in fact, if you look back, June 15th was the date when the outbreak in Tampa really started. And this is coming from the folks at Tampa General Hospital, and we were able to liaise with them really well. So we have Jason Wilson, who we were talking to throughout. Also, Dr. Asa Oxner, who was the head of COVID outpatient testing at Tampa General. She's actually a co-PI on a lot of the work that we're doing now. And we were able to speak directly with them. Just after we finished the last household interview, that's when the first Congolese actually started to get sick. And it was actually June 14th, which was the day before the spike in Tampa, that the first Congolese went into the hospital and got sick. So then the work started becoming almost like first responder work, where, Eugenie and I were doing a lot of translation with the doctors. I was on phone calls with the folks from Tampa General and the Department of Health, because when the Department of Health folks found out that there had been an outbreak in a refugee community, they were very concerned about this. And I was actually able to, on the 15th, say to that crew of doctors and Department of Health people, look, don't go to the refugees as if they don't know anything. This is not a problem of them being dumb or uneducated. The problem is they don't have the abilities and the capacities, to do what they know they need to do. Now, some of that, you can look at one of the questions we asked, which had to do with social distancing. And people were very well of social distancing. They knew the word for social distancing in a couple of different languages. They knew it was 6 feet or 2 meters. But at the same time, people complained a lot that they couldn't perform social distancing at work. They were working in workplaces where there were no mask mandates and where people were packed in pretty tightly. So we're talking about factory work and also fish processing work. Those were the main ones. The other thing that people told us is that they could not practice social distancing at home. Many of the recommendations coming out were saying to make sure you have a sick room, an extra room at home for anybody who gets sick. And that actually was taken as rather offensive to people. If you have 3 people living per room and then you're being told, well, you need to have a reserved extra sick room for someone who gets sick, this was just something that was impossible. And so you have all of these structural issues that were compounding things. The other big issue was unemployment. And this hasn't been in the news as much, but the Florida unemployment system was so bad that there was a congressional hearing about this. I still think this is something that is just a stain on DeSantis's legacy here, but they, set up, and actually this goes back to Rick Scott, they set up a system in Florida that was designed to fail. It was designed to not get people unemployment benefits. And I think through the summer, there were still 1 million Floridians who didn't get their unemployment benefits. And from the Congolese that we sampled, I think there was only 1 or 2 families that got any unemployment benefits. And they were very upset about this. We had 1 or 2 folks in the community who had actually gone around and helped everyone apply. So most families had applied for unemployment, but simply, and this is right through up until today, have received nothing from unemployment. And I can go on about that. We've contacted DEEO through people at DCF. They just replied to us with lies, honestly. We've gone to lawyers. The lawyers are so overwhelmed with this. All they can tell us is we have webinars that you can learn from more about what you can do, but there's little we can do. Most of the Congolese did sign on to lawsuits and petitions about this, but that got nowhere. What that meant, though, the reason this is so important is that people had no income and people were very afraid of eviction. Many of them rely on cars, so transportation is an issue. And that's actually when the first outbreaks took place. They were almost all people who were working in workplaces where they felt they had to continue working because they had no other income. They were not getting unemployment. The only way to get to work was through carpooling. And that was where people started contracting, despite using hand sanitizer, despite wearing masks. They were contracting it largely from their workplaces and then passing it to one another in their cars. I then worked with DOH doing a lot of contact tracing. And again, the major vectors early on were these workplaces. And some of these were workplaces I found out while doing this contact tracing that weren't supposed to even be operational. They were places that had said that they had shut down months before. And that also just speaks to a lack of worker protections and any sort of the kind of economic regulations that we need to have safe workplaces. And so, I think that while a lot of blame recently has been placed on partiers and young kids going out, what the real issue is that we have been dealing with is, workplaces. And workplaces early on were a real big issue. And people, again, saying that because they didn't receive unemployment, they had to continue working. Just going through some of the other quick things here. I can actually just maybe pass this back to Robbie at this point. Let me just say this before I run out of time, because I know we're up to 2:30 here. There are some important implications, I think, from all of this, and I could go through all of our data. Our report is available online. You can actually find it on my faculty webpage, but I'd be happy to send the link to you. We have a number of important implications, though. One of them is that this kind of research is doable. I think that's one of the important ones. There were many people over the summer who didn't know what they could do, and it is possible to create environments for participant observation and obviously do the interviews using social media. We had a number of community meetings with people from Lutheran Services of Florida and Jewish Gulf Coast. Those are the two major resettlement organizations right now. We did do some work early on, just translating and working with the folks over in Pinellas County as well as Hillsborough County. What we found is a very similar kind of an outcome, but that also allowed people to get to know us. It allowed us to exchange information. It allowed us to talk to the folks at DOH. One of my favorite quotes to come out of this is the DOH refugee coordinator in Pinellas County, who almost had a breakdown on the Zoom meeting and said that they are just drowning in COVID, while at the same time they're getting mandates from the state saying, stop working on COVID, go back to normal, go do what you were doing. And so it was just extremely difficult when the state system was working against us the way it was. But it is doable. Now, it obviously helps to have our long-term contacts. I don't know if we would have been able to do this if we didn't already know many members of the community that are trusted and they didn't trust us. But that's why, as anthropologists, we try not to burn any bridges, obviously, and you never know when you can come back and work with certain people and certain participants. Maybe the last thing here before I turn it back to Robbie and she can talk about where we've gone since then. Two little things. One is that, funding. We applied, I think, for 6 or 7 grants this summer and we got nothing. Most of the grants for COVID were not community-based. They were for clinical trials, and this was an issue we found with internal grants. This was going around here at USF, but also the external grants that we applied for having to do with education and COVID response. These were rapid COVID grants. They didn't like our project. At the same time, many of these grants have not been so rapid. Even the rapid grants that we have applied for ended up being delayed quite a lot. So we actually did all of this research before we even had many of these grants submitted. We just had to do it. It had to be done when it was done. And part of what's really great about our data is that our data was with the Congolese household heads all collected before the actual outbreak. So when we collected the initial data, nobody had been sick yet here. And that's really kind of important because now we're going to, as we continued to work through the populations, we saw what happened as it spread. We found a number of traditional remedies that people are using, and we can talk more about that if there's interest in that. We also found a lot of hesitation to get testing. And so after people started to get sick, that actually in many ways became our role, was talking to people, convincing people to get tested. And their response was, if people go to the hospital and just die, if there's no cure, if there's no vaccine, what would be the point of going and getting tested? And many families decided it was just better to stay home, to use the traditional remedy, but we had to do some convincing and we had to tell people that, look, it's important to get tested. I did a lot of work meeting people in my car. I would guide them to the testing clinic. I would be there in my car and they would pull up and I'd be able to wave and give them a thumbs up and I'd be able to call the nurse. So the nurse would come out and take them directly in. That was mostly at the Mahoney clinic on USF's campus. People were very afraid of the hospital. But that's where actually working with the doctors at Tampa General was really great because the suggestion was, well, what about USF? So they trusted USF, and the Mahoney clinic at USF was not seen as the hospital. And so they were very comfortable going there actually. And that's where most people got tested, and they had a really nice drive-up testing set up there that worked well. But coming back to funding, I do want to mention, we were able to, and part of this is my colleague here, she's very good at reaching out to the faith community, and we got really great response from the faith community. So while it would have taken months to hear back, and it did take, in some cases, months to hear back from some of the COVID rapid response grants, we got an immediate response from initially from synagogues and from the Muslim community. And so it was really the Jews and the Muslims were immediately very, very happy to give us some money, small bits of money, but many of them said, you know, we have more money if you need it. We then heard more from churches, and we ended up getting around $1,000. That money was really important for us because it allowed us to pay for some of the soap that I discussed that we were able to distribute. And actually all of that money went to families. We didn't get any of that money. And our community-based research assistants were the ones who we ended up being able to pay for their time doing the work that they did, doing interviews and working on this project. So we were able to get most of that money right back to the community. The other thing I just want to quickly mention, if you do read to the end of the report, there's a term that we use in there called immediate anthropology. And, you know, I know this isn't a real theoretical talk, but this is an idea that we've been toying around with. Part of this, and I don't want to take too long on this, but, you know, 5 or 6 years ago, there was a big refugee crisis in Europe, and many anthropologists jumped to go and work on this issue. And if you read anthropologists like Heath Cabot, who's written about this, you know, there were issues with that, right? You end up standing with a bunch of reporters watching people drown. And, you know, there's a lot of reasons why we should be wary of media-based crises. And what Cabot calls for and other anthropologists have called for is slow anthropology, that we should really take our time, that we should be slow to make sure that we understand the context of these crises. At the same time, this was a situation where people were coming to us from our own neighborhoods and saying, we need help and we need help now. And so we were able to switch gears very quickly and do this kind of what I'm thinking of as immediate anthropology. And by immediacy, I don't just mean temporal, as in right now, but also proximal, as in these are people who are living in our cities and living in our neighborhoods who need this kind of help. And we were able to use our skills, and this is what we have as anthropologists, you know, the linguistic skills and the understanding of culture to address a lot of these issues. And I think we actually played a pretty important role. Now, again, we're dealing with some structural factors that there's very little we can do about. But I think it's really important to be able to highlight those issues and highlight those structural inequalities and give that information directly to people in public health, at the Department of Health, at the Department of Children and Families, so they knew how to best use their resources. But that's what I have. We have then developed this project much further with many more collaborators and many more populations. So I'm going to turn this back over to Robbie so she can talk about that.
Okay, thanks. I'll talk about some of that, and then I'll throw it back to Dillon to talk about our very newest thing that we're doing, for which we actually finally got some money. We did find that graduate students were interested in working on the project for experience and for authorship, but we were very concerned about paying our community-based researchers from the Congolese community. They had all the language skills, and they themselves were struggling. So we did go out and hustle that money from the faith community, who were marvelous. Okay, as Dillon said, there were a lot of people sniffing around wanting to do work with refugees, a lot of people from out of town, a lot of people with big, fancy, elaborate projects. But we ran into some people from from the med school who were associated with public health, and they wanted to do something with refugees. And initially, we went into a little anthropological crisis of, what are these people doing in our village? Okay, get out of our village. It's our village, especially because they were public health people. We were really a little upset. But then when we talked a little further, it turned out that we were wrong, that collaborating with these people made a lot of sense. They were placed over at Morsani in the med school, and they had access to amazing resources. Remember, we are still broke. They had med students who were required to do a summer project, and they weren't going to get paid, but they needed to do a summer project. So they had one med student who spoke Arabic. He didn't read or write Arabic, but he spoke Arabic. So we took that med student and we connected him with Radiant Hands. Now, Radiant Hands is a community organization for Arabic-speaking refugees. I had just finished doing a big project with Radiant Hands, helping their catering company, which was started as a self-help empowerment group for women, do an ethnographic cookbook. And my class had just finished doing this. And it's not out yet because of COVID, but I had just had an extensive experience with Radiant Hands, and I was close with the director there. So we went into a long series of negotiations with Radiant Hands about replicating the Congolese project there. We kept saying we want to do phone interviews, WhatsApp interviews, the way we'd done with the Congolese. And we got a lot of pushback on it. We finally gave up. They said, no, we gather information from our community by sending out a Google form for people to fill out. We send it out through our WhatsApp list, which reaches 80 families. That's what we want to do. So we created a Google form that was as open-ended as we possibly could. We sent it out through them. Ahmad worked with his mother to translate it, and then Radiant Hands fixed the translation. They didn't like it. There are complexities to Arabic, which I clearly don't understand. And we sent it out, and it was slow coming back. We finally got a sample of 20 households, which was our goal from that community. They are predominantly Syrian refugees. I think there's 1 or 2 Iraqis or Afghanis in the population. And we're in the process of analyzing those data. Now at the med school, they really wanted to reach out to 2 other populations. They wanted to reach out, they had a clinic for homeless people. And they wanted to have one of the med students, Ahmad, work with the homeless population. So we revised the Congolese interview to be appropriate for homeless population, created that in English, got a volunteer to translate it into Spanish, and we're all set to do that when we got the big spike in Tampa, and it was no longer safe to have the homeless clinic in person. So that is still sitting on the shelf. Nothing ever happened with that. The last population that the med school was interested in reaching out to was the Spanish-speaking refugee and immigrant population. Now, this is not a population that we particularly had a long-term relationship with at all. So we used the classic anthropological technique of networking. I thought, how can I get to a Spanish-speaking population through anybody I know? Now, many years ago, I worked in Ruskin with migrant workers, and I could have operationalized those contacts, but I thought, that's going to be really complicated, especially when we can't be in person with people. I decided not to do that. So I went through Caribe. Caribe is the organization, it's a part of the Hillsborough County Schools that teaches English as a second language classes and citizenship classes to refugees and immigrants. And I got in touch with the director of Caribe, and I had worked with him extensively because another one of my class projects with refugees was creating American stories. These are books of oral histories of refugees, which we collected, transcribed, and then rewrote at 3rd or 4th grade reading level, so they would be material for refugees to use in their ESL classes, something they could relate to beyond the, Dick and Jane chase their dog kind of material that's available for beginning English learners. And we had done 1 volume of this, and then my class in fall of 2018 had done a 2nd volume, which is not out yet, again, due to COVID. But I'd had a long relationship with the director of Caribe, and he was a pretty big supporter of anthropology. So I went to him and I said, is there any way that I could connect with your Spanish-speaking students in the ESL and citizenship class? So he said, well, let me ask my teachers. And then I put together a different team for this. I had a 4th-year med student who did this just because he was interested, who spoke Spanish. And then Ahmad, the Arabic-speaking med student, who's a 2nd-year med student, had a friend who was just starting in Morsani Med School this year, who was Colombian, but who'd grown up in the United States and was fully bilingual. So Brennan and Ahmad and Alfredo and I went to probably about 10 different ESL and citizenship classes on Zoom. We introduced ourselves in Spanish. We said, here we are. We want you to know our faces. We want you to know who we are. We're asking for volunteers. We want to find out how you think about this and also what your needs are. And we had put together, we thought, a pretty good structure for dealing with any needs that we found in those populations. And we got probably about 16 or 18 volunteers from those. Well, we got more, but it turned into 16 or 18 solid interviews. And then we used a few more of my community connections through some other refugee organizations to get a few more people to interview, to end up with a sample size of about 20 of the Spanish-speaking refugees and immigrants. And those data are currently being analyzed. Ahmad, Brennan, and Alfredo are working on all of this. And I think they are shocked looking at the difference between the data we have coming from the Google form, which is really thin, and the really rich data from the actual Zoom interviews that they did with the Spanish speaker. It's a very dramatic demonstration of the value of real interviewing versus, just send out a questionnaire. And this has been a learning experience for them. None of them had any background in anthropology. We use Zoom training sessions for them to teach them how to do this, to teach them coding. There's a lot of qualitative data here, and learning how to code that, deal with it. So this has been a collaboration also with the medical school, which again builds relationships for the future that we will be certain to take advantage of. So we have 3 projects going in Tampa now. And I think, well, wouldn't it be interesting if we had some comparative data? So I called up my friend Carolyn Behrman in Ohio, in Akron, Ohio, who I've been working with on refugee stuff probably for about 10 years. We initially did parallel projects on dietary issues in Burmese refugees. And she was all interested in this, and she proposed to do Congolese refugees, Karen Burmese refugees, and Bhutanese refugees in Akron. She got hold of 2 interns who initially were willing to work for nothing. And then when we got money from the faith community, she went to her faith community. She was even more successful. She got about $2,500 from the faith community in Akron, and was able to run her project on those kinds of donations. And again, authorship for people involved. Those data are also all collected now, and that is in the process of analysis as well. A third site, which we are still trying to get going, is Houston. One of the leaders of the Congolese community in Tampa moved to Houston. Dillon reestablished a connection with him, and we were trying to set up connections to the Congolese community in Houston through him and through Sheila McCurdy, who is a medical anthropologist who I knew in Houston. We've had some snags there, but Cheryl, has a research assistant who she's paying in Tanzania. But it doesn't matter if you're in Tanzania or the North Pole, because everything's on Zoom these days. So her research assistant in Tanzania, who speaks Swahili, is going to be doing these interviews with the Congolese community in Houston. I mean, why not? But we've had a little trouble kind of getting this project going, getting contacts. We're hoping this is going to work out. That's kind of, hopefully we'll get this going in the next week or 2. And then Cheryl ran into a postdoc in Houston who was from the Lebanese Druze community. Druze have an interesting religion, which is sometimes similar to Christianity and sometimes it's similar to Islam, but in fact it's totally different. But she had contacts with a group of Syrian Druze refugees in Houston. And we are trying, again, we've had trouble with these contacts in Houston, but we're trying to do this also with that population in Houston, which would make an interesting comparison with our Syrian population in Tampa. We're just going to see how it goes with Houston. It's gotten a little bit a little bit complicated there, but we can probably get it to work out. Patience is probably what's called for here. Then Dillon and I decided we weren't crazy enough already. We needed to sort of push the envelope further. He's teaching applied anthro this semester. I'm teaching 2 sections of medical anthro. And we decided, well, you know, we're reduced to Zoom for these classes. What if we did an actual project in our classes that would sort of engage our students, draw them into this topic? So we revised our interview for household heads a little bit to make it more appropriate to college students. And my students and Dillon's students were assigned to each interview one person who identified as Republican, one person who identified as Democrat, who was a USF student. We will have a sample size, the data are all in now, we will have a sample size of 200 interviews, 100 Democrats, 100 Republicans, and our classes will be analyzing these data and presenting them toward the end of the semester. And if the lecture series would like to invite us next semester, we can let you know what our students found out, or maybe bring some of our students to do the presentation. We think it'll be really interesting. When the students do the presentation, it'll just be, you know, basic kinds of analyses, but with a sample size of 200, we may be able to run some statistics on this. This is all qualitative data again, so it's going to be a really rich data source, and I think a good opportunity for our students to become involved in research and see how this plays out. So that is currently going on. Now, if we weren't crazy enough with that, we decided that we actually needed a follow-up project to the Congolese Household Head Project in Tampa, focusing more on Congolese youth. We had done a lot of work with Congolese youth on issues of bullying. In fact, we did 6 focus groups a couple of summers ago with the Congolese youth. These were bilingual focus groups, so the kids largely wanted to talk in English. We separated those by males and females, and so we had a relationship with the Congolese youth over the issues of bullying that they'd faced in the schools. We decided that one of the issues that might be really interesting to look at was the issue of identity. In addition to all of the stuff about understanding of the disease, precautions, all of the other issues for young people, including, you know, breaking the rules of avoiding people and all the rest of that, we decided issues of identity might be really interesting because we knew our Congolese kids were getting bullied predominantly by African-American kids in the schools. And with all the Black Lives Matter protests, we were wondering how this would impact the Congolese kids. Would they start to see themselves as Black American, African American? Would they choose to continue to identify as Congolese? We thought there might be something really interesting going on here. So we wrote a grant. We actually got the grant, first grant we got out of all the ones that we wrote. And I'm going to pass it back to Dillon to talk a little bit more about that project because this is currently in progress.
Yeah, sure. And again, if people have questions, we can talk more about specifics. I know we're running through a lot here really quickly, but what we are currently working on is this new project. It's specifically an anti-racism COVID-19 grant working with Congolese refugee youth in Tampa and also in Pinellas County. We had actually already done 15 interviews with Congolese youth over the summer here in Hillsborough County. And so we had a fairly good idea of what we were going to find. We were looking a lot at remote learning, how people were dealing with technology, but also these issues of identity and how people were understanding what they were seeing in the news. I was actually doing an interview the day that the George Floyd protests got rather violent in Tampa in the same neighborhoods that people were living in. There was a lot of talk about, you know, protests and such on social media, on Congolese social media, where they're very active, and I'm Facebook friends with most of them. And so this became the sort of basis for where we were going to go. We're still in the planning phase for that. And one of the issues that we've run into is, you know, on the one hand, people are exhausted now. Early on, I feel people were very happy that somebody was checking in on them and seeing how they were doing. A lot of people just want to get back to normal. You know, more than ever, we're running into the issue of, you know, it would sure be nice to just be able to go knock on people's doors and just talk to them. But we're still having to do this all remotely. And so we're coming up currently with a program, an online program for the fall. And what we're going to do is use this program. We're actually next week, or in 2 weeks, I hope it's next week, we'll have a meeting with Congolese online influencers. So youth who are very active on social media, we want to have a meeting with them to talk about the kinds of things that we could do with an online program. So we already know that people want, for example, talks on how to get a driver's license. They want talks on how to get into USF. They all want to go to USF, but they really need some advice on these things. We're going to do one on how to check email and write email professionally, how to work on resumes. A lot of the Congolese kids here that we're doing this work, I actually have a list of Congolese resumes that I need to edit for people. And so this is the kind of thing that we're going to put together, and then we'll be able to create a participatory environment through those meetings to then recruit people for the interviews. You know, that was the issue that we were running into is, you know, if we just cold call people and say, hey, will you talk to us? You know, people are kind of tired, you know, so how do we develop a more social environment? Luckily, the grant affords us a year, although we want to get these data collected as soon as possible for comparative purposes. But that's what we're currently working on. I know we're getting my 5-minute sign has been held up here to me, I think. So, but I want to leave time for Q&A. We are also obviously always available. You can always reach out, email us. I'm hearing from people all the time. So let me just stop there so that there's enough time for questions or discussion.
Yeah, and if, you know, turn on your cameras, guys. We don't see people very much. Turn on your cameras, ask us some questions. You can either raise your hand electronically or raise it on the screen. Jonathan, first one I saw, then Kevin.
First of all, I'd like to thank you, Robbie and Dillon, for such an informative presentation about so many different efforts and projects that have been going on. So my question is, given the scope and the number of projects that you all have been working through as the pandemic has been happening, how have you negotiated your informed consent process with IRB in order to, you know, have one that covers each aspect of the project you're focused on?
Okay, I'll take that because that's the first thing I did in April when we started thinking about this. I thought I need an IRB. And I thought, no, this is an evaluation. We are evaluating people's understanding and response to pandemic policies put out by the federal government and the state. And I did what I always do. I sent a paragraph to IRB and I said, this is an evaluation. And initially I put down refugee communities in the United States. So that was broad enough to cover all the refugee groups in Tampa, and the refugees in Akron are covered by that. Then when I thought about the homeless population, I put another one in and I said, we're going to expand this to Americans, which covers what we're doing in class, and it would have covered the homeless population. And we need to present our results not as research, but evaluation of policy decisions and how people have responded to those. Now, for some of the youth stuff, Dillon has a couple of other IRBs open that cover a lot of the additional questions that we are asking of the Congolese youth. So we are covered under those. But I would say if you're planning on doing a project, the very first thing you want to do is to you know, get your IRB in. That's really critical. Where I can, if there is justification for it being an evaluation, I put that in. And I think we're okay on that. And that's the way we have proceeded. I made these very, very broad. The first one said refugees in the United States. The amendment to it said, not amendment, the second version of it said Americans. And that was good enough. We just have to be careful how we describe this and how we write it up. We always have informed consent, of course. We never take people, well, we never attribute things to individuals. Sometimes we actually take people's names if we're trying to get help back to them. With the Spanish population, there are a lot of people who'd lost jobs. I could connect those people to people at DCF who connected them to Lutheran Services, and we actually got some jobs for people who were out of work. I was just astounded. But you know, in any of our publications, obviously, we never use names. All the data are aggregated. We follow all the ethical things, you know, 150%. But we got permission for this, at least the initial stuff, as an evaluation. Now, Houston University there wouldn't accept our IRB. Akron did. So Houston needed to put in an IRB. They put it in using exactly the same language, and it came back approved. You know, this is pretty straightforward ethnographic research, except you're doing it on Zoom.
If I can just add one little thing to that, I will, and you mentioned this, but you know, the lesson is when you do have IRBs to work with a population, don't let them expire. Keep renewing them. You know, so I'm on 3 different IRBs that are already active IRBs with the Congolese community here, including one specifically to the youth. So we were able to actually revise that one for the upcoming project and basically just add, we were already actually asking some of the similar questions and had approval from IRB from last year to do something similar. So what we were able to do is just tweak and do a revision to that IRB also as well. So I mean, I again feel like we're pretty well covered because we have multiple approvals actually.
Thank you.
Kevin, you had a question?
Yes. First, I want to say thank you so much, both of you, for this excellent presentation. It's really, it makes me proud to be your colleagues, and it's really impressive. And I think all of us have really gained a lot and learned a lot from this. And to see also, you know, just very important and critical ethical research, you know, as a real life ongoing thing, and the kind of promise that applied anthropology has to address these issues. It's something I'm really, you know, it's very impressive, and you know, thank you. And I had a more specific question though, and that is, so in the case of the Congolese, in terms of the questions, it was very detailed, the presentation. In asking them about COVID and so on, were there any kind of, you know, intergenerational differences? So that, I know you were just mentioning about the other project that you have about, you know, the sort of second generation and so on, kids, but were there some differences in what the parents understood and what the parents did in terms of their, you know, attempts to prevent, you know, getting the disease, getting the virus, and what the kids were doing, what they knew, you know, that kind of thing. And I know they were out of school by July, so it wasn't like they were getting that kind of information. But anyway, that's just a question about that.
Yeah, I mean, I could take that quickly. That's one of the reasons that we decided we needed to do a project with Congolese youth was to look specifically at that. And many parents, when we talked to them, did say, you know, they were following all the precautions, but the kids were having a much harder time with that. Oh. And, you know, they said the kids were, you know, not only struggling a lot with online school, many people said they're just not doing anything. They don't know how to use the computers, et cetera. But then the kids really want to hang out with each other. And, you know, it's hard when they're all stuck inside. It was making the parents go crazy. It was making the kids go crazy. And so a lot of the kids ended up just going to each other's houses or doing things outside. They tried to follow social distancing, but again, it's tough. So that was one of the big reasons why we wanted to go and actually look a little bit more on, you know, at the youth and ask them, you know, are you following the rules? Are you breaking the rules? And they are following them, but again, not as much as the parents. The other thing, though, when you talk about generation that was really interesting we ran into was, you know, when we talk about household heads, that becomes kind of complicated because you have some families where you have 2 parents who are, let's say, in their 60s or 70s, and then the actual household head is somebody who's maybe 25. And in certain cases, we would go to a family and say, could we interview somebody who's the household head? And we would actually interview somebody who was much younger because they were, in a sense, the representative of the family. And so we actually did get some folks in their 20s answering as household heads for, let's say, their parents or grandparents. And we even there picked up some differences. Obviously, the younger folks were more technologically literate. They have a very different view of, you know, they're excited about the US. They have certain expectations of what the US will provide. I think the older folks are just excited to be alive and excited to have an opportunity for their families to do well. There was more religious influence in the thinking in the older generation. We did have one family that I should point out that didn't think that COVID was really something you could do anything about, because it was, everything was in the hands of God. COVID was really just like fairies who were jumping around, and they had this very interesting kind of, supernatural understanding of COVID. And that was a family that was run by an older man. And so there was some of that generational difference, but for the most part, we found a lot of consensus, I think more consensus than otherwise. But to get back to your original question, this is one of the big reasons why we want to talk to the children, or to the kids. I shouldn't call them children, but to the kids. And I will say also, it's a lot of those young men in particular who are going out and making money. So older folks stayed home, and then younger folks who would have been pursuing educations ended up going and getting jobs. But then they're the ones who are carrying, it around. And so I worked a lot with the generation of folks that are like 20 to 25, talking to them about getting tested and talking to them. And to be honest, as soon as they couldn't work until they showed a negative test, they went and got tested right away, as soon as they realized that they needed to get that negative test to work. And they got kind of into that. There's a really, really interesting generation who are young adults. And those are really, I think, the leaders of the community. And that's what we're trying to focus on more in this new project.
Right. Okay. Thank you.
Yeah.
And thanks again, both of you, for the presentation. Awesome.
So I think we have maybe time for one more question from a student.
Okay, I have more time, actually. I don't know what time your Zoom is going to run out, but I'm willing to stay longer for questions. I saw James, you had a question? You muted, James.
Yeah, hi, thanks everyone. Thanks, Dr. Baer. Listen, I want to thank you all for this. I'm not a current student. I graduated in 2015, but I currently work for the State Health Department in Texas in a public health emergency preparedness capacity, and I follow the USF Anthropology Department's activities for ways to stay fresh and incorporate an anthropological lens, particularly methods, I think, into what we're trying to do and understand our communities, and to help plan and operationalize appropriate, inclusive public health emergency response, right? So our office is based in Houston Metro, but we directly serve 7 rural counties with no local health departments. Some previous HIV work, I know that they have a lot of they have a pretty significant immigrant population and refugee populations. Mm-hmm. And so that's what we're dealing with right now, right? Those are the ones that we're really trying to get into right now and understand better kind of what the obstacles and needs are. One of the things that we found is that there is a lot of hesitancy, right, to pursue life-saving medications in case of an emergency, especially when we ran a bioterrorism exercise not too long ago. And so now that we're looking down the gun of a vaccine coming up, there's very active discussions about how we're going to be able to communicate this with populations. And I think they're, generally speaking, the state of Texas is looking at the broad audience, but they're not looking at very specific focused audiences like would be a refugee population or immigrant population in some of these rural counties. I'm wondering if y'all had any insight into that community or what that discussion might look like when we're talking about vaccines. Thank you.
James, we did have a question on all of our questionnaires about what would you do if you tested positive? What would you do if you thought you had it? What would you do if you tested positive? If a vaccine comes out, would you and your family take it? Why or why not? The Congolese originally were pretty gung-ho on all of that and then got more hesitant as we got actual cases in their communities. I don't have the data analyzed from our Arabic-speaking and Spanish-speaking populations in Tampa, nor the data from Akron analyzed yet. But if you shoot me an email in a month or two, I will have those data. So just email me and I will send you those reports when they are ready. I think by the end of October, we should have our report on the Arabic-speaking population available. And I think the end of November is our target for the Spanish-speaking population. And then Dillon and I are planning a paper on 3 cultures in Tampa. They'll probably be ready by sometime in December. And I don't know how fast we'll get reports written on the data from Akron, but we can certainly get you raw data. So just shoot me an email, give me the specific pieces that you're interested in. Check out the Congolese report that is on Dillon's website. Our questionnaire is in there. Tell me what pieces you're interested in, and we can pull those data for you as soon as we get a little closer to analysis.
Thank you so much, y'all. Thanks.
Are there any other questions? I'm not going anywhere. I don't have a big life, so I sit here talking to my computer all day, except the times when I talk to my cat, who thinks I'm actually talking to her because there's no one else in the room, so I must be talking to her. She was evicted from a qualifying exam meeting this morning. She gets evicted. I see some of my students here. The cat gets evicted from my classes constantly. Any other questions for us? I appreciate people coming. I appreciate your interest. If you want more information about our stuff, read the Congolese report. We are on email day and night. And if you're interested in getting involved in any of this stuff, we might be able to find places for people who want to help out. We're still operating on tiny budgets, but we can offer experience to people, sometimes authorship, more fun time on Zoom, whatever you find yourself enjoying these days. As I go through this today, I'm really blown away. I mean, this has kind of grown little by little, and just running down all of it for you now, I can see why Dillon and I are both going pretty crazy. This semester, when we're back teaching and everything else, we are juggling a lot of projects here. The Akron is totally moving on its own. Houston, we are probably going to need to get more involved in making that happen. And at Tampa, we have our three med students doing a great job on analysis, although when they get their reports written, we will probably need to go over those a bit. But it's been a great experience working with med students. Let me tell you, med students are really smart. It has been a really interesting experience. So I'm going to turn it back to Kieran. I thank you all for coming. I thank Kieran for organizing this.
Yeah, I was just going to reiterate for everybody, though, that we are, before everything gets published, and we're going to be turning this into publications. Obviously, we do have a publication on the Congolese work coming out in December that is based basically on the report, but we are also turning everything into reports first that can be shared. So we will have those reports, and we can share them with any of you as soon as they're available. Really quickly, I would say, just because you mentioned this, I mean, it's been great to work as a team, because when you're doing this kind of work, I think between the two of us, we may have taken 4 days off all summer from working. We had an amazing writing collaboration where we were constantly shooting things back and forth, and to be on a team where you can kind of pass the baton, and when one person gets burned out, another person can kind of pick up. That's been really important, especially because obviously we've had to kind of take care of our own mental health throughout all of this. But we've made it work. And so, I want to thank Robbie for making it possible. There you go, Kieran.
Well, thank you, Professor Baer. Thank you, Professor Mahoney, for being there.
Kieran, can I say one more thing also? The applied piece of this. Now, we did give back directly to the community. If we interviewed people who had problems, we, again, tried to pass those concerns on to people in social services who could solve those problems. We also are taking our reports. They go to Hillsborough County Commission, particularly to Pat Kemp. They go to Luis Vieira on the Tampa City Council. We've sent them to our connections in the health department in Hillsborough County. They go to the Refugee Task Force. They go to Gulf Coast Refugee Services over in Pinellas. We do send these reports around as much as we can and try to get the information out in that fashion. We really are trying to do the applied anthropology thing as best we can here from our living rooms.
Well, thank you, presenters. Thank you, audience members. I have been recording this, and so I'm not sure exactly where it might be posted, but it may be someplace on the USF website, and be aware of the presentation in November with Professor Castaneda and Professor Kusimba about migration. And we haven't figured out what's happening in the spring, but perhaps we'll have students from the project present something in the spring. So thank you all for being here, and enjoy the rest of your afternoon and enjoy your weekend.
Thank you.
Thanks for coming.
Thank you.